Hi, I'm Dr. Mache Seibel, editor of My Menopause Magazine. I've just come back from Dallas, Texas at the annual meeting of the North American Menopause Society, and I took the opportunity to do a video interview of a number of my colleagues about their latest research. Here's one of those videos now. Okay, first of all, let me ask you just to state your name.
My name is Michael Krychman.
And you are?
I am the medical director of the Southern California Center for Sexual Health and Survivorship Medicine. I'm also an associate clinical professor at the University of California, Irvine, both in Southern California.
And he's also a fabulous speaker who has a lot of important information on the subject that matters to a lot of people. And what he's going to tell us about a little bit is breaking the silence. So if you wouldn't mind, talk a little bit about what you spoke about earlier.
Well, I think it's really important that there is a lot of discrepancy between male sexual function and dysfunction and female sexual health as well. And we see this as a discrepancy both in the media and social acceptance. It's okay for men to talk about erectile difficulties, and it's okay to see media and print concerning male sexual problems, but women have not had their voice. And we know from prevalence studies that there's 64 million postmenopausal women, and 32 million, or approximately 50% of those, do suffer from vulvovaginal atrophy or dryness, which is very strong.
So this, just to interrupt for 1 second, vulvovaginal atrophy is basically a shrinking of the tissues of the skin that's around the the outside skin of the vagina.
Correct. When a woman goes through menopause and stops having her period, she loses estrogen stores, and this affects the tissues of the vagina and the vulva, amongst other things. And it's dry and pale and frail and inelastic, and it leads to painful intercourse. And it's interesting that we see that both there's barriers on both the clinician side as well as the provider side and patient side. We know that patients are remiss and they do not bring up the topic of painful intercourse, and they don't talk about dryness. They associate menopause with hot flashes and feel that dryness is a normal part of aging. And healthcare professionals do not discuss the issues. They feel that if it's bothersome enough, women will talk about it, and women are embarrassed and what have you. So there's a lot of barriers, and we see from a lot of the patient educational surveys that women are enduring painful intercourse. They're succumbing, they're engaging in painful intercourse in spite of the fact that it's painful and troublesome, and they are really living in silence with a condition that's very distressing and very painful.
You talked about an enormous percentage of women that endure a painful experience so that they can maintain their sex and sexual function.
Correct, and I think it's very important. There's a variety of reasons that women will engage in sex even though it's not pleasurable or even comfortable. And the primary reason from many of these patient surveys was to preserve the relationship and maintain their relationship with their partner or spouse. So I think there's a variety of different reasons, and women really are living in silence with a condition. And I think it's really an exciting time. I would encourage people to pick up People magazine, latest issue, and really recognize that sex and women are coming to the forefront. There's a lot of new companies with new medications that are really committed to bringing the discussion out of the closet and out of the silence, and really educate women that sexuality is a vital part of the human experience, and that sexuality is very much linked to general health and wellness and a very important part of quality of life.
How would you, if a woman is having a problem, how would she, it seems obvious that a woman or a person would know they're having a sexual problem, but how do they broach it with their doctor? What do they say? How do they break the ice? What tips can you give someone?
Well, I think it's very important that a patient be prepared before they go to their healthcare provider, and sometimes it's important to mark it down. And if they can't verbalize it, sometimes giving a written question or concern to the allied healthcare provider, the nurse, the mid-level, sometimes it's the initial thing that brings the discussion to the forefront. I think it's very important to tell and sometimes using your own words, your own vocabulary, starting from a place of comfort is very important. Using words that you're comfortable with. And I always say that a good healthcare provider is never afraid of a second opinion. So understand that if you feel that your needs are being dismissed by your professional, it may be time to look for another provider who is more sensitive to your needs and is really asking and answering your questions and concerns.
And I guess you could make sure that people realize that if their doctor is not going to be embarrassed, and if the doctor is embarrassed, they can refer them to someone else.
Of course, and many clinicians, we also have to recognize that clinicians are not always appropriately trained in sexual health, both in normal function and dysfunction, and it's a very evolving science right now. And it's okay to not be an expert in this specific field of medicine, but where I find it troublesome is that there is networks available where both clinicians and both patients can find providers that are sensitive to their needs and will actually treat their quality of life concerns that are troublesome.
Any other points you want to make?
I think the most important point that I'd really like to make is that we need to educate women that sexuality is a vital part of the human experience, and it's not just this esoteric, let's feel good concept. We know that sexuality and intimate relations have positive effects on general health and wellness. It improves compliance, it decreases chronic disease, it improves longevity. So there is a concept of ageless intimacy, and I think it's very important that women understand that there are many things that they can do that are safe and effective to help preserve and maintain and enrich their sexual lives as they enter their mature years, and I think it's a vital part of the human experience.
Thank you very much.
Great. Thank you very much for having me.